Welcome to our masterclass today on how applied kinesiology can make you a better therapist. And if you're not a therapist, certainly you to be a healthier person as well as your friends and family that you use this on. Because the first person to work on is yourself. And I got so many results, great results, just working on myself. Like whenever I have a pain, I can generally get rid of it within 30 seconds. As well as emotional stress. We're going to show some great emotional stress techniques today. I'm going to show you also how to find what's at the source of a person's issues. My name's John McGuire. I've been the founder and director of Kinesiology Institute for the last 42 years. I've been practicing both on clients as well as teaching. I've had the great fortune of teaching students from 93 countries online as well as teaching in 17 different countries. I was the program director of the Touch for Health Foundation back in the 80s, where I worked right alongside John Thie, who developed Touch for Health, wrote the Touch for Health book. I was his chiropractic assistant, and I had the great fortune of then being his director of education for the foundation. Brought it to Italy. It was the first instructor training in Italy as well as in Russia. So it's now spread throughout Europe. And I've also had the great fortune of studying with the founder of applied kinesiology, Dr. George Goodhart, in his certification program. And that was 42 years ago. And it's just been a delight to see the results of the people that I've been able to share this with. I get feedback. One of our students from many years ago, she just texted me today. She says, you know, the profound difference I've made in so many people's lives out of the instruction that she's gotten through our programs. And some of you have been in my programs. I wish you well to get me information about what you've been doing, because I always love to hear, and questions as well. People are able to ask questions. So let's do a little tune-up first. I'm going to have you touch the umbilicus, the belly button, and then we're going to touch right under the collarbone. Now what these points are called switching points. This is kidney 27, the last point on the kidney meridian. It switches the brain on. And so as you rub kidney 27, touching the umbilicus, I want you to look around with your eyes, breathing deeply, and it switches on both hemispheres of the brain for learning. Then I'm going to have you put your hand up in front and go around in a circle. This integrates the visual cortexes of the brain, right and left brain. Then use the other hand. Watch the thumb coming up and going around. Now what this does then is it helps to use your whole brain for integrating the visual information, and now we're going to do the auditory information by doing the ear unrolling technique. So do this along with me. First, turn your head from side to side and see if you've got a stiff neck either side. Now what you're going to do is take the rolled over part of the ear and just pull it away from the opening. Just going like that, making big ears like Dumbo. What this is doing is it's called auricular therapy in Chinese medicine. The ears act as antennae for the qi that flows through the body. This is that bioelectrical energy that powers the body. So we're boosting our energy, but it also is helping to have better auditory input and retention in your brain. Let's see what happened after you do that a few times. Turn the head again and see if that relieves some stiffness in the neck. Sure did for me. Okay, then one last thing, we're going to thump the thymus. Now this is right around where your second button would be, so just pound on the chest like Tarzan did. Take some deep breaths, and this activates your immune system. Also great whenever you're under stress. Okay, so now let's talk about what applied kinesiology is and what it does. The foundation of it is it uses manual muscle testing. You can think of muscle testing as a biofeedback indicator of what's going on in the body, both energetically, biochemically, structurally, as well as emotionally. See, when we're under stress of any of those types, the information, the circuitry of the body gets stressed so that we're not getting accurate information across to say, hey, we got a problem over here. How that ends up in the body is you get tightness, stiffness, tension, pain. In fact, every symptom that you have is a result of what we call energy blockage. So when you're doing any kind of work, holistic work, you can think of it as this. Whenever the person comes in and they say, I've got sleep disorders, I have digestive problems, I have back pain, I have headaches, the bottom line is they have energy blockage. With muscle testing, you can find out where the energy is blocked, what's blocking it, and how to fix it. Goodhart used to say this. He said, assess the need, which we do through muscle testing, as well as examining, listening to their complaints, any palpatory skills, whatever you do to listen to the person's energy system. Then after assessing the need, we supply the need, which means give the body what it wants. I'll be demonstrating this in a bit. So assess the need, supply the need, and then observe the result. So observing the result is, do you feel better? Is there better range of motion? Do you have more energy? Did the symptom go away? The pain relieved? And so often you can do this immediately. See, I have a background in body work. I was doing myofascial release similar to Rolfing and massage and shiatsu. I took every course that came along. But the challenge was this. See if this sounds like you at times. I would throw my toolbox at people. Oh, you have back pain? Let's see. I'll try this technique. Okay, that can't help. Well, let's try this one. I'll do this. But I didn't know what to do when. So when I studied with Goodhart, I found out there's a method of finding out where the energy is blocked and how to unblock it. When you just simply do that, people get better. I hear this all the time, how someone had, say, neck stress, pain in the neck for years. What I did with her is I ended up discerning, which I'll demonstrate today, that her problem was biochemical. See, she had been to chiropractors, physical therapists, massage therapists, acupuncturists, and they're all throwing their techniques at her, and she's not getting any better. So finally, after 4.5 years, someone suggests, well, go to a kinesiologist. She found me online, came to me, and in one session, I discerned, oh, her problem was biochemical. Well then, in a matter of one session, totally got rid of pain for 4.5 years, and it never came back. I saw her subsequently about a month later, did a tune-up on her. I saw her a year later, and she just called me after 2 years referring some actress with, I don't know, 400,000 followers on Instagram that she says, this actress wants to work with you now because you get great results fast. Now I'll give you another example. I had a man who was given a prescription of Ambien because he couldn't sleep, as well as Xanax because he had anxiety. Fortunately, I got to see him before he got addicted to these because they are highly addictive drugs. So I went through my protocols and I found out his problem was structural. Now, what doctor would say, oh, you probably got a structural problem if you have that. But the bottom line is muscle testing told me what to do. So then we cover this in my structural kinesiology course. We got one coming up this summer where I found out it was cranials. He needed cranial adjustments. He literally needed his head examined. And I found out, oh, there was something that was affecting his pineal gland, that affected his melatonin, that affected his sleep, that then affected his GABA and basically his anxiety. And just doing that simple correction the next day said, hey, I slept great, the anxiety's gone. So the key is in applied kinesiology, we find out holistically what's going on in the person physically, biochemically, emotionally, and energetically. And everyone's different. See, we have bio-individuality. That's where everybody's different. It's another advantage of applied kinesiology is rather than one size fits all, which back when I did myofascial release, I did 10 sessions, like Rolfing, if you've had Rolfing. It's great work. There are times, and we teach this in my structural course, where you need to do that technique. But Goodhart said this. He said, you rolfers, the problem is you rolf everything in sight. Sometimes it's actually contraindicated to specific areas. You need to know where you need to do it. So we have a test that shows you when you need to do that. So each person comes in with their specifics. So we're able to discern, is there an emotional element? Is there a structural? And then we do what's called priority balancing, where I'll show you how you can find out what the priorities are. See, my great mentor, Dr. Sheldon Deal, who is, he's probably taught more people worldwide than any other kinesiologist. He's actually traveled 3 million miles. They call him the prophet of applied kinesiology. And he says, first of all, the body is a seething mass of compensations. The problem is most people are treating the compensations rather than the source. You want to treat the source, not the symptoms. The analogy you can think of is if you have a puddle on the floor, are you mopping it up and the puddle comes back? Try a better mop, a different mop. Try different ways of mopping it up, but not looking at the ceiling where the hole is. That's what we're doing in kinesiology. We're finding the source. But you'll see that you have really simple skills. That's another great thing about applied kinesiology. We have people that, even say lay people that don't have any medical background. One woman, Veronica, she was a structural engineer. At 40 years old, she decided, hey, I want to help people doing work that makes a difference in their lives. It's great to design buildings and bridges and all that, and she was making very good money. But what happened with her is she had a problem no one was able to fix. She went to a kinesiologist, Dr. Bob, applied kinesiologist, great guy out of Vegas. And in one session, her problem no one else could fix was gone. She says, wow, I want to do this. Well, she found me and took my certification program and has a very prosperous practice with over, I think, 10-week waiting list. And she says, wow, finally I found my calling, something that I can get incredible results and transform people's lives and make a good living. So that's a lot of our students end up doing that. So we've got Skylar in the house. Welcome, Skylar. How are you doing?
I'm good. How are you?
Excellent. Good to see you. So Skylar, we're going to show some skills of doing muscle testing. Now, if you're new to muscle testing, first thing we teach is how to get accurate results doing this. So here's what you do. Any problem with your shoulder that I shouldn't test it? You know, no pain in the shoulder or problems?
No.
Okay, drop the arm down a little more. I usually like it a little further down, just around 40 degrees, okay? So with the hand relaxed, I'm gonna put my hand right at the end, and she's keeping her elbow straight. So what I can do is push with gradual increasing pressure, just the weight of my hand, and go a little further, and it's locking. Okay, now I wanna see what happens when it switches off. One way to do that is you can say a name that isn't your own. So say, oh, how about, my name is Donald Trump.
My name is Donald Trump.
And hold as I push. And her arm's saying, well, that's a little bit stressful, assuming that identity. Now let's say, my name is Skylar.
My name is Skylar.
Okay, and hold. Okay, so now I know the difference between an on and an off. Now we can do these on the table, we can do them standing, but I'm going to show you now that when I touch an area, we call that circuit locating, also known as therapy localization in applied kinesiology. It's saying when you touch an area, if there's an energy blockage, it will test weak. So the ones I'm going to start with, we teach this in my fundamentals course. We have one coming up in a couple weeks in hands-on in Long Beach, California, June 1st and 2nd. So I'm going to put 2-3 fingers right here between her eyebrows and see what happens. As I push, hold. Now that's strong. I'm going to put over here at a cranial articulation where the frontal bone meets the sphenoid bone and push again and see what happens. And that's strong. Now I'm going to put my hand back here at another point that the occiput meets the temporal and parietal bone and see what happens, and hold as I push here. Oh, see, it switches off. Now in the course we teach the 5 elements of Chinese medicine. And the way you can remember them is knock on wood, that was the wood point. This is the fire point. Wood feeds fire, fire feeds earth. So now when I get this weak, and for you that have taken the course, this would be a good review for you. Once it's weak, I say a meridian. So I'll say spleen, and what happens is it stays weak. Hold as I say stomach. Oh, it changed to strong. Now the way you can remember this is a change is going to do you good. So when something's weak and I add something else and it strengthens, it says we need to do that. So it's wanting to have a balance of the stomach meridian. Now every muscle, write this down, every muscle in your body associates with a acupuncture meridian and an organ. So in this case, the pectoralis major clavicular is the arm in front, straight in front, and you're pushing down and out. So I'm going to push like this down here, and you meet my pressure. Okay, hold as I push, and you see that one going. Let's check the other side. Bring this one up, and hold as I push. That one's strong. So on this one, it's not as strong. Now what I can do, I like to use what are called finger modes. Write these down if you haven't seen them before. This one is structural. My pad of my thumb touches the index finger. Let's see what happens. Okay, so as I do that, hold and see if it goes strong. It does. That means I need to do some structural work, which could be the origin insertion technique. We teach this again in the fundamentals. The origin insertion, you can adhere it back to the bone doing firm massage. It also relates to what are called neurolymphatic reflexes, that are massage reflexes. In fact, we did a video, almost every day I get feedback. We did a video, remember, with how to relieve pain in the stomach? And that one that we showed doing this very technique, people said, oh wow, I was having horrible stomach aches and I did this technique and it cleared it. You know, so that's where you can really get a lot of results with this. So now what we're going to do is I'll use the next finger. This is nutrition. Let's see what happens here. Hold as I push. It didn't strengthen. So that would have been potentially diet addition, deletion, or a supplement. But because it didn't strengthen, my body's saying, well, that's not an issue. See, that's why we can find out what exactly we need to do. Now, this is emotional stress. So the thumb to the ring finger, see if that strengthens and hold. It does. Got any stress that's been going on with you?
So a few weeks ago, my cat freaked out and scratched my nose, and I've been hoping it doesn't scar. They can't see it on the camera.
Okay.
But it's can you see it?
No, I don't see it. I think we're good. But in the meanwhile, yeah, in the meantime, so when there's a incident like that, see it's got a weak muscle. Okay, think about clearing the stress on that and hold. And the muscle goes strong saying, yep, we need to clear that. Now let's look at another finger. This here finger is the little finger, which would be acupressure points or other things we cover in our energy course like auric fields, Tibetan figure eights, chakras. So let's see what happens. That goes strong. So now what it tells us is we need to do structure, emotional, and electrical. So let's demonstrate that. Why don't you lie on your back, head down there. When I test the muscle here, I'm going to put pulling out like this, ready and hold, and there it goes. Now what I can do is have you touch what are called the neurolymphatic points right here. This point is at right where the breast meets the chest wall, between the 5th and 6th ribs, and hold as I push. You see how that went strong? Now touch up here. These are the points for emotional stress, and that clears. Now relax it down. Okay, again, this arm is weak. I'm going to touch what's called the tonification point. We cover this again in the fundamentals course. This is stomach 41 that draws energy into stomach and hold, and it's strong. So that tells me what we need to do. So why don't we have you rub right here, going from the sternum all the way out where the breast meets the chest wall. I'm going to rub a spot in the back, and I'm going to touch these points on the head. Doesn't matter who touches what. Is there any tenderness along there?
Yep, it's all tender.
Yep. The greater the tenderness, the greater the extent of the blockage. In fact, let me get in here with this hand.
Do you think it could also be from the soft dry fast I just did?
Oh, a fast that you just did?
Well, I did a dry fast, so I didn't drink or eat for like 3.5 days. Like no water, no food.
Possibly, but not necessarily. But let's see what we got. And if the tenderness goes away, just keep moving on to the next point. How's the back? Is the back tender at all?
It's getting better.
Okay. Now what I'm doing is I'm touching very lightly on the forehead as I rub firmly with that. And the greater the tenderness, the greater the extent of the blockage. And also what you'll find is if they have pain, as I mentioned on our YouTube video, you can look up Kinesiology Institute at, I think is it at Kinesiology Institute after the YouTube, and you'll see a lot of videos if you haven't already watched them. And this one on relieving stomach pain is basically doing that technique. And so many great reviews of that alone gets rid of the pain. Because remember, what causes pain? Energy blockage. These are switches that get energy flowing. They're like, they take these meridians, which again, I got another point down here. I can touch right here on stomach 41, and I can just touch it lightly and then breathing, and I feel energy flowing in there. So we're taking all the blocks along the highway and clearing those out so energy flows. Now I can also do this. There's a technique called meridian trace. So I can go from the eye, right under the eye, and sweep down, don't even have to touch the body, and go right to the end. And usually I do that 3 times. And let's see what happens now. So I've done the neurolymphatic, the neurovascular, the light touch points on the head, and the meridian tonification point, as well as trace the meridian. Let's see how that arm tests now. Hold as I pull. Very strong. Can you feel the difference? I'm pulling like 10 times harder.
It's so easy for me.
I can't. I'm really giving.
I'm
oh
doing
my God.
nothing.
Yeah, and she's like, but before there was like nothing there. Do you notice any shift after doing that?
For some weird reason, I feel like this side of my body's lifting, like this side. I
Oh,
don't know
okay.
why.
All right. Well, let's go further. Any problems with your joints or wrists or anything?
So what was weird was before I started my soft dry fast, I went running, but then so my joints kind of started feeling like they're hurting like under my knees. And then when I went on my soft dry fast, under my right knee started hurting more.
Ah.
And but then I started feeling better after my soft dry fast. So I don't know if it's going to stay that way, if it's going to come back because I just started eating again.
Okay, so under the right knee.
Yeah, that's where I felt
Okay.
it the most. But
All right.
I also felt it in my ankles and both knees. But
Well, here's again, what you can do is you take a strong muscle and touch the area and see if it goes weak. It does. Now here I'm going to show you the priority mode. The head points are already priorities. This is where you touch the thumb to the crease, the middle finger to the crease of the thumb in that middle joint and see if it goes from weak to strong. Okay, without touching, again, I'm touching the back of her knee. Hold. Now I'm going to touch here and it goes strong. So, that says we need to fix that. So again, when you're working with people, you can zero right in. I would do an hour-and-a-half sessions, and often I get more results in 5-10 minutes of doing AK than before I knew AK and was just throwing my toolbox. Now again, this is structural. That came strong. Nutritional, no. Emotional, no. And acupressure, yes. Okay. Now, so here's what we can do. I can say structural techniques, okay? Balancing muscles. Okay, balancing, let's see, popliteus. Yes. Now the popliteus is the muscle behind the knee, and it's often involved in knee problems. When someone has a knee problem, that's what we teach in our structure. We go into every joint. What are the muscles you need to balance? So I'm going to have you bend the knee, and I'm going to push the foot in like this. So I grab the foot, and I'm pulling it out. Ready? And hold as I pull, and there it goes. Okay, so what I'll do, so one of the techniques I'm going to do is origin insertion. See, this is the insertion, the back of the tibia. And how's this? Is this tender at all?
Oh, that hurts like a lot.
Yeah. Goodhart used to say, it's exquisitely tender.
That's it.
Yeah, and so amazing things sometimes happens when you do that origin insertion technique, where people had problems for a long time. And think of it like this. If you have a hinge in a door, it's going into a solid board, the door jamb, and the other one's on the door. And if the hinges aren't screwed in properly, the door wobbles. In fact, I had one that was just wobbling. Every time the wind would blow, it would shake. So we ended up getting the screwdriver, And that's what you're doing. You're screwing the muscle back down to the periosteum. And when you do that, that alone will often fix it. Now we could also do the neurolymphatic. Here's how I know if we need it. We're going to have her, she can touch or I can. She's touching right here on the neurolymphatic for gallbladder and liver, and oh, it is weak. So you rub that, and I'll catch the points in the back. But there's also light touch points. They're the vasculars for the popliteus, is right where the muscle is, behind the knee. So I'll do that. When I go see Sheldon Deal, I get to shadow him, which is just a delight to see him watch him work with patients. And what he'll do is one hand he'll have on the neurovascular, the other one he'll be rubbing the neurolymphatic. So it's a great way to approach for you that are doing this work, another tip. Okay, so let's see what happens now. So I'm going to test the muscle again. Oh boy, it is super strong. Now I touch the back of the knee, and that's strong. So see how that feels now. Of course, would it be something you need to walk around with, or can you tell just from moving it how it feels?
Let's see, this knee feels like, I'm trying to think of the exact words, like this one, I'd say the knee doesn't, like it feels like something's a little bit off, but this one feels like it's like perfect now.
All right, well
Like
we've attained perfection.
Like I guess I don't know if the exact word's weaker, but it feels like a
Okay,
fragile.
well let's check that knee out. See, that's where you can do this work and find exactly what you need to do where they have issues. Now here, I'm going to touch the knee and see what happens here. Hold as I push. Now arch your head back. Hold as you push. Wow. Okay, now this is another technique we teach in the fundamentals as well as the structural. It's, according to one of my other teachers, Dr. Wally Schmidt, the most important thing you can do with people. So watch this. Now, it's called injury recall technique. Have you had any injuries that you're aware of with the knee? You know, it could even be just falls or could have been from any time in life.
I think like 3 years ago, I fell down pretty hard on the cement, and I kind of slid a bit, and it scraped my hand pretty bad. I have a scar right here from it. So that could have hurt my knees.
Okay, wow. Well, there's so many great things here. Let's start with that. Now, here's another way you can go through this. Arch your head back, and I can just screen joints. We already saw that one's involved. Let's see if there's anything over here. Nope. Here, here. Okay, that elbow's got something. So these are areas. I can check the ankles. They're good. You can check anywhere in the body, but those primary joints. Let's check the hip here, okay, and here. But this knee and the elbow. Now, interestingly, you relax the head now. In our structural class, there's a whole thing called contralateral joint. The left knee relates to the right elbow. So sometimes you'll have problems in corresponding joints, like a shoulder problem, right shoulder, left hip, whatever. So, but for now, we're going to do this technique. One of the benefits of the injury recall technique is you pull it out first to see how the range of motion is. Tell me when you feel a stretch.
Oh, a little bit more.
Right there? Okay, so now we're going to see if she gets any better range of motion. This is a really simple technique. What she's going to do is bring your knee up where you can put your hands on it. Just, you know, like say the whole knee, just kind of covering it like that. Okay, while she's doing that, I just simply do this. I lift the head up and she just relaxes and breathes. And I'm moving the atlas on the occiput. In other words, the top bone and the neck, I'm toggling them so they're coming apart in the back and back together. Apart, back together. Apart, back together. And you do that about 4 or 5 times. Then, up to 10. Then you also can do this. You can bring this is called the talus joint, or the mortise joint, where the talus meets the tibia and fibula. So that mortise joint, I'm just pulling on it a few times like that. Now, Sheldon Deal says, tap it in. These are a technique called temporal tapping that locks in a correction. Okay? Now, let's see what happens. Just relax that. So I'll see if we cleared this one. Hold back, move the head back, and that's good. Now let's do this elbow. So bring your hand over, left hand over, and grab this elbow here. We'll do the same thing. So left hand on your elbow, right here. Yeah, anywhere that it feels like it could be out. Do you have any pain in there or anything you're aware of?
I keep getting carpal tunnel in this hand.
Okay, well, we'll look at that
no,
next.
I think in that knee, I'm trying to think. I think in the elbow, sometimes I do randomly feel things, but it's so random.
Yeah.
That like I'll forget sometimes, but then it'll come back.
Yeah, and that does happen. Okay, now what you're doing then is the mortise joint, you're doing it on the side where the injury is. So I did the left leg with the knee, and now the right, again, I'm just going and pulling it out like that. Or I can also toggle like this. So now let's see what we get. And, okay, I'll hold it this time. You hold head back, X, and there we go. So now, let's see, we cleared it. So let's see if there's any better range of motion, because you get overall better range of motion when you clear these things. So let me know when you feel the stretch. Wow. Still going? You're good? No stretch yet?
Okay, now I feel the stretch.
Now you feel it. Oh my God, she was like this. Look how much more range of motion. And you'll see that with people. Here's the deal on injury recall. Again, we go into this further. There's so many other areas you need to do, like for mammograms, root canals, you do a whole thing around that, and scars. She mentioned a scar here. May not have time to do it today, but scars are major roadblocks, especially along meridians. We cover that further in this structural course. But in the essence, when you have a memory of an issue locked into the cerebellum, which is a part of your brain sensory system for your body and positioning, it creates energy blockage in an area that creates stiffness as well as likelihood of future injuries there. When people say, oh, I got a trick knee, or I keep injuring that ankle, or whatever. Okay? So now what we're looking at then is what is out where there's energy blockage, how to unblock it, like we do the finger modes, and we do that in all our courses, but particularly the one coming up if you haven't done it yet. And for you that have done the AK fundamentals, if you want to come to the hands-on course, I believe you have an email that shows you how you can join for a very reduced price to get that hands-on experience. We have people flying in from all over the country for it, coming up June 1st and 2nd in Long Beach. So you can look for that. And if you have any questions, just share them with us. Now, let's take a little break so I can show you what's coming up and give you a special opportunity. On the screen share here, you'll see when you go to kinesiologyinstitute.com, you'll see right here a purple button under the video that shows the AK Fundamentals course. Now right here, you can enroll for a payment of $497. You get lifetime access to this. And if you haven't done it yet, click here and you can get $100 off this course by filling out a 2-minute survey. So if you have already, you'll get the code, you can apply that. So you just click there to enroll. Or if you want to do the 3-payment plan, that's also optional for you. And for anyone that enrolls by this Friday, we're going to have an additional program where I will live be working with you similar to today, where you'll be able to get extra coaching, which is generally several $100s more. So by this Friday, you can see everything you're going to learn, more about me and what some of our students have said. It's just phenomenally effective for just starting out. If you're new to this, that's a course you want to do. Now, if you want to go on, just click on here to the Long Beach class. Again, that's right here, and you'll see all the details for that, where you really get great supervised practice with me and my assistants. So you're able to get some very good coaching on what to do when with as things come up. Plus you get worked on. That alone, people find, oh my God, that was worth it, just all the balancing that I got and achieved. While we're at it, I'm going to just show you the structural course coming up. Again, to go back to the home page right here, this I mentioned some things. This one is in Long Beach, California. There's a whole intro here you can watch. Looks like a 30-minute video where I give more instruction. And you also, by the way, you get 96 CEUs in this class. You get 16 in the fundamentals if you need that. if you're a massage therapist, body worker. And so you can jump in on that. It shows you all the amazing things you're going to learn. And this can be a foundation of your practice between the fundamentals and structural, particularly if you're a massage therapist or body worker, you'll be in great shape. She mentioned carpal tunnel. I've had many of my students as well as my clients that were scheduled for surgery, and just doing simple techniques that we teach, particularly in our structural course, be able to avoid that. Now, there's times when surgery is really helpful, really appropriate. So we're not saying forget about surgeons. I love surgeons. In fact, some of my best friends are surgeons. We have students. I don't know if Frank, you're here from Germany, but he's an orthopedic surgeon and he's loving this stuff. So we love surgeons because they often save lives. Now, with the carpal tunnel, though, there's a muscle, the Opponens pollicis, and another one called the Opponens minimi digiti. I'm sure your mother taught you that. And the way you test it is you bring the thumb and the index finger together, where I have my hand to keep the other hand here, keeping her finger straight. I'm going to pull it apart and you hold it together. All right, hold. And there, it's not so good. So grip my hand and just feel what it's like to shake my hand and grip it. Can't really grip it very tight, can you?
I'm trying, yeah.
Yeah, there's nothing there. Wimpy.
Oh, and I can feel something in my elbow.
Oh gosh, okay. So now what we're going to do is we're going to strengthen these muscles. So the way I'm going to do that is I'm going to take, again, the origin and insertion, and let me know if that's tender. Now do this on yourself, folks. See what I'm doing? I'm rubbing right along that insertion of the Opponens minima, or the Opponens pollicis, and she's not loving that.
Yeah, I can definitely feel it.
Okay. Do it on yourself, folks, and it often, especially people that are working on keyboards all day, or if you're a massage therapist, this is real common. I had a potter, by the way, who was ready to give up her career. She's saying, I'm working on the pots and I'm having so much stress, I can't work anymore. And in one session, doing this along with some nutritional supplementation, it's often calcium or B6, we got her back and continued and no more stress. Now there's techniques you first want to avoid putting your wrist like this. Like if you're pushing on something, as much as you can, keep your wrist from bending back, because that's what collapses the carpal tunnel, especially an accident where they fall and they go bam. That's a first thing to do, as well as, again, calcium and B6. I'm going to do a calcium test on her in a bit and you'll see what happens here. Okay, so I'm working that. Now it's getting worse, okay? Yeah. Now let's also do this. Let's do this. I'm using the fleshy point here of my hand. I'm also squeezing the wrist. So take it and just squeeze together, because that builds the carpal tunnel back up. And then I'm going to go here. And so I'm rubbing on that muscle now where that origin insertion is. Okay. And let me test. I'm going to touch the wrist and put my hand on it and see what I got here. Okay, that's strong now. Let's pull this, push this together. Again, hold the thumb and the index finger together and hold as I pull. Wow, it's really strong now. Let's have you grip my hand. Shake my hand. Okay, you feel I got more power in there?
Yeah.
Great. Is the elbow feeling better too?
Yeah.
Excellent. Okay, so again, you find where the muscles are switched off, switch them back on, and often amazing things happen. Now let's see what else we have. I remember you saying you had some challenges, and we're going to get into emotional stuff in a bit, but you said you had some sleep challenges, is that right? Where you were not falling asleep?
So during my dry fast, after the third day, I started having sleep issues, which is why I ended it at 3.5 days. But I'm still kind of having sleep issues. I'm trying to pass out earlier, but I just can't. And like my body just wants to stay up and it feels hyper at night.
Okay, I'm going to give you 2 tips on that. One is calcium and magnesium are often deficient. Now, in our biochemical course, we show nutrition points you can find if they have a deficiency. So again, I have a strong muscle, and then I'm touching the calcium point right over the left clavicle and hold as I push. It goes weak. Now I can touch just to the right of the umbilicus, that's the magnesium point. So again, strong muscle, I touch there, it goes weak. So right away it's saying, oh, I know there's a deficiency. Now let's have you do this. I want you to touch with your left hand, just one finger on the tip of your tongue. Okay? So that's strong. I'm going to say B vitamins. B1 goes weak. B2, strong. B3, I could keep going, but B1 goes weak. Now, just so you know, if you're having trouble falling asleep, often it's calcium magnesium deficiency. Can be just magnesium, but sometimes just calcium, but I like to blend them together usually. That, for me, if I ever can't fall asleep, I do a couple of those capsules or pills and boom, I'm out. Now the other is B1. If you can't fall asleep, B1, take this note down. If you can't stay asleep, it's B2. And that's one of the ways we test it using the Riddler points from our biochemical course. Now what I can do here is think about your challenge falling asleep. Got it?
Yeah.
Thinking about that, she goes weak. I'll grab B1 here. Think about that again. Now putting a supplement in the person's field, we have a biofield that picks up energy. In fact, okay, B1, well, you can get it from various foods like leafy greens would be good because maybe you're having been on the fast, you're not getting that. Okay, so now what I'm going to do is I'm going to put the calcium magnesium. Again, think of the sleep issue. Oh, I can't fall asleep. Keep thinking of it, can't fall asleep. See, as soon as I put it in her biofield, everything has an energy field, a frequency. And when that frequency goes into her biofield, it says, oh, that'll help. And there's a couple tips here, acupressure points. This works great, I find for myself. Most commonly, it's large intestine 20 that you would tap if you can't fall asleep. Also sometimes bladder 1. So what I can do, again, if an acupuncture point needs work, a strong muscle goes weak. Now I can use any muscle. I've been working on this arm, but just drop this one down. Now I'm going to touch right at the bladder 1 point, and that's fine. Let me do the large intestine 20 point, and it's going. So that's where you could tap. I go up to 50, maybe even 60 times like that when you're going to sleep. And as you get higher up in the numbers, slow down like a train just coming to a stop. Every time I do that before I'm falling asleep and I do that, I start yawning within a few taps, and then within 2 minutes, I'm out. So there's a couple tips for you, and we'll get you some of these supplements you can take going home and see if that helps, all right? Goodhart said anything can cause anything. So that's why I like to go through the modes. So let's just, for instance, like I mentioned, the guy who had sleep issues and anxiety, it was his head. The woman had stiff neck, it was her diet. We've had another nurse practitioner that studied with us. She had back pain. It turned out to be her auric field. I had a woman that was told she may need a knee replacement. In our energy course, I cleared her auric field and the pain went away. So that's why it's great to have a comprehensive toolbox of techniques where you can work on the structure, work on the biochemistry, work on the emotions and the energy fields. So it's often a combination of all. Sometimes you get lucky and you get one technique and boom, I say work on a person's popliteus like I did on her, their knee pain goes away. In fact, we had a student, she said, I've spent $4,000 trying to get in my knee pain. And in the same room, we're having the AK fundamentals course. She took that class and in 4 minutes, she got rid of her knee pain. Just nobody knew the right screw to tighten that turned the whole operation on. So sometimes you get lucky like that. So we always keep in mind the whole person, and that's where we show you how to assess, and that's what we're doing here. Let's do a little emotional stress release correction. Skylar, you mentioned you have some emotional stress going on?
So when you go on a dry fast, your body kind of gets like stressed out. And it was also like my mind was kind of stressing out. Like I wanted water so badly because I didn't drink it in 3.5 days.
Wow.
And it was like all I could think about. And then I did water fast for 2 days after, and then I kept thinking about food. I just kept looking at all these recipes, and I'm like stressing out, thinking like, oh, what am I gonna eat? Like I just want to eat and stuff. So I think that probably stressed my body. But I'm down in weight, so I'm so happy.
Okay, good.
I don't regret it.
All right, good. Now, how about any issues in your life that you've been stressed about. You don't have to talk about it. And that's the other good thing about this. When you're working with somebody, they might say, oh, that's very personal. They don't even have to say a word. They can, but they don't have to. Got any issues that are going on in your life?
Yeah, something yesterday kind of happened that kind of poured into this morning. I've pretty much resolved it, but it was just really frustrating that happened.
Okay, well, let's see what happens. Now I'm going to use an arm that's strong, hold. Now think about that where you get a feeling in your gut about it. Got it? Hold as I push. And there it's going weak. So that means there's energy blockage, there's stress. So again, there's emotional stress, physical, nutritional, and environmental stressors. So what I'm going to do is have you think about this. This is a technique we cover in our 8 Key Fundamentals along with our emotional stress release courses. So I touch very lightly on the forehead. And what I want you to do now is just breathe slowly and deeply. You can do this with eyes closed or open, either one. And I just want you to notice what you saw and heard. Was it someone talking to you, or was it an image, or what was it?
Text.
Text, okay. So you're just seeing the text. And just breathe, relax breaths, and just notice without reacting to your emotions. Just notice what emotions you had as you breathe again deeply and relaxed. And folks, you can do this on yourself as you're watching whatever stressor you have as you listen to me. Just observe what you saw and what you told yourself when you saw this text. And just notice that, like it's out in front of you, like a kind of a cloud passing in the sky. I'm touching very lightly and tugging slightly up on the skin as I touch these points. Just notice whatever comes up, what emotions are there, and just let them be there and relax into them. And now notice any body sensations. Any place in your body where you're feeling tightening or pain?
The back of my head, like right on this exact point.
Okay, great. Just notice that and breathe into it. Just being aware of it. Again, take some slow, deep breaths from the abdomen. Just let that energy flow. And as you fill up the abdomen, and just let go of anything you're holding on to around that. Just feeling like, oh, I'm just letting go of that stress in the back of my head. Letting go of whatever I told myself about that. And now, how would you like to feel about this situation?
I'll just forget about it.
Okay, just released. Okay, forget about it. No big deal. Okay, so feel like detached. Okay, I just let that one go, and it's beyond me. It's no big deal. And just telling yourself, I'm letting go of this. And just feel that letting go. Okay. And now let's test it again. So think about that situation, that text, before it made you weak. So let's see what we got now. Hold as I push.
A lot of text, actually.
Okay, a lot of text. Okay, just thinking of all those texts. And let's see, when you think about it, now it's really strong. So what do you notice different now as well as before? How did you feel different?
I feel a lifting like from here, and then I had a little bit of tension in the back of my head, and that's going away. Like it's like releasing.
Great. Okay, yeah, this technique, if John Thie taught me, he told me, if all you did is what I just showed on everybody, and that's all you did, 80% of people would get better, because so much of our physical pain and stress is related to the emotional stuff we're carrying. We cover that much deeper in our psychological course. But it's a fact that stress, emotional stress, is at least 70% of physical conditions has much of its root in our emotional, including cancer. One of my associates and clients, Carl Simonton, he was the first oncologist to work with emotions. He came to me and I asked him, he says, you know, I find that almost 80 to 90% of people who have cancer as patients had some major emotional event that happened on average 18 months before their cancer was diagnosed. in case in point, my brother, who unfortunately went through very rigorous cancer disease and ended up dying, I found out that 18 months before his cancer was diagnosed, he had a major upset with his ex-wife and his family. And I just wish I could have been there to help him clear all that, because I was in Hawaii and he was living in Ohio. But you'll see that many times. Emotional stress release, very important to clear. So how are you feeling after what we just did?
I feel a lifting, like, especially like from here up.
Great.
Like it's like maybe like it's the emotions like releasing from my body.
Ah.
I think that's what it is.
And how is it to move? Like move around a little bit, because you had things going on in your legs, your wrist. She's walking around a bit here. And then come on back and tell us how you feel.
I feel improvements in my knees.
Uh-huh.
But now my ankle, it's like kind of cracking.
Cracking. Okay.
Yeah,
Well,
like a crack noise.
that crepitus could be some energy releasing as well.
Oh, okay.
But you feel strong and balanced?
Yeah, like it doesn't feel weak, but it like made a cracking noises. Both of them, my ankles.
Okay. So back to what you found was you got more energy, and it's like you feel uplifted in that?
Yeah, like I just feel like this rising. I still kind of feel it like going like now. Like at first, I felt like it was going more from my chest. Now it feels like it's going like more from my head.
Great.
Upwards.
Well, that's releasing energy blockage. So that's what you come here for. And as far as the emotional issue, do you feel like, I'm free from that too?
Yeah, I actually forgot about it.
Well, that's what you said. It's over. I'm going to forget about it. And you forgot about it. Okay, well, that's...
Now I remember again.
Okay, great. Okay, well, thanks for coming in, and we'll look forward to seeing you in the next video, because get on our YouTubes and our Facebook, Instagram. You'll see a lot of Skylar doing other things with us too, so there's lots of things you can learn. So I want to remind you, for any of you that haven't taken the class, and if you have and you're on this and you want to join us, we're going to give you additional sessions that I'll be working with you to make sure you're getting the fundamentals and jump on board with us. I'll go one more time to the video, to the screen share. Okay, so just to remind you, going back to the website here, where you can enroll in either the course coming up in Long Beach, clicking here, or the online course, you want to click on that button, choose your payment plan. So when you go to kinesiologyinstitute.com and you click here on the button, either course, then you're going to find the payment plan. So choose what you want, and then if you do have the code, you can put it in here, click apply, and then you can pay. Just go to the checkout if you're not paying with PayPal, and then you can enroll with credit card, or if you did want to use PayPal, you can do that down here. Okay? Yeah, so for you that want to have the online version of all of the advanced courses, we have a sale just through Monday, that's Memorial Day coming up, where I can send you an email that has a link that'll show you how to get all those for a $4,000 discount. Now, I'm enrolled in a master's program myself, and I'm taking one course that's basically looking at things online. There's no videos, whatever, in this course. And I'm just well, there are a few, I think, but I'm just looking at videos, and I have to pay my tuition. And my tuition for one course, it's an A&P, is more, I think it's around the same price or more than all of our courses that I just mentioned. All of our advanced courses, you have lifetime access. And I'm going, oh my God, this is a really good value, because we're giving people things that transform their careers. And we have many people that have studied with us, they're making 6 figures a year. So it's a really good bargain. And then you'll have that opportunity to also get in courses like this. We do masterminds, and we come back and have you ask your questions and get them answered. So we really are here to serve you. And that's what this work is all about. It's making a difference in people's lives. The greatest value that I've gotten is hearing patients and clients tell me things like the one man who was told, "You're dying, we think we need," he's in the hospital, "We're dying, we think we just need to refer you to hospice because we've run out of resources." Fortunately, I got my hands on him and we did sessions, 2 sessions every day for several days. I cleared every acupressure point on his body, something we teach in our energy course. And I talked to him last week, 10 years after he had this incident. And I said, "How you doing?" He says, "I'm doing great." Whew. You get these kind of results, and we have them all the time. Another one of our students, she's just started, she's done the energy. I think she did the psychological, and she's coming to our structural class. She showed me a video of a guy who had 25 years of severe pain that nobody else helped. He went to everybody. And it turned out that 4 sessions of him working with her totally got rid of his pain. And she showed me this video. It was amazing. So that's the kind of results you can get with this. Our intro course is for more non-professionals. It has basically the AK fundamentals is your prerequisite for the advanced courses. The intro course is not needed if you're taking the AK fundamentals. So if you're interested in particularly using this with clients, we recommend the AK fundamentals as your starting point, and that's great if you have no background whatsoever. That's a good one to take. So again, if you go to the website, kinesiologyinstitute.com, click on the AK fundamentals, whether you want to do it online. Now the online course you get entirely when you do the AK fundamentals hands-on. So you have lifetime access to all the online. You can start studying before you show up at a hands-on course. Now, in the event you can't make it to Long Beach, and we have another one, say, coming up in the fall, you can then take everything you've paid and then just do the upgrade to the hands-on. So you're always able to do that. Thank you for making the Kinesiology Institute your best choice in health and wellness education. I'm looking forward to the opportunity to help be your guide to mastering these techniques to make profound differences in your own life as well as the lives of your friends, family, and your clients. Until then, be well and be blessed.